So I'm here today with Dr. John Whelan. John, where are we today, and what are we doing here today?
Well, we're here today over at the Legion in Dartmouth, Nova Scotia. This is where we hold our regular monthly meetings for the Trauma Relapse Prevention Group, and this is for Canadian Forces veterans who've in the past been diagnosed with post-traumatic stress disorder. Most are released from the military right now, and this is a follow-up to a program, a group-based program we do, and helping them come to terms with operational stress injuries, post-traumatic stress, and in just adjusting or transitioning to civilian life.
So John, what kind of veterans and serving members would find themselves interested in coming to a program like this?
Well, folks who've been released from the military, you know, they may have gone through post-traumatic stress disorder treatment within the military. They've subsequently been released, and now they're a veteran. A lot are isolated, their symptoms are back, they're not doing well, they don't know how to move forward in their lives. So the group was really brought into being to help people reconnect with other people, you know, get these symptoms under control, but really to move forward in their lives and to have some positive things happening versus just, you know, focus on all the negative things from the past.
Now John, before a person comes into group therapy, before the person starts participating in a group like this, is there other things that perhaps they should go through, or other precursors that are necessary for them to really get the maximum benefit out of this?
One is, this is not a first disclosure program. By this I mean people are not going to come into a group and for the first time talk about their military experience. They've gone through individual therapy in the past. A lot of folks may struggle with, you know, substances as a way of trying to manage themselves, like drinking or cannabis or even some medications. So they don't have to be completely absent coming into this kind of program, but we really want them under control where they can participate, that they're not so preoccupied with substances that they can't, you know, engage other people and talk about.
Okay, so I'm here with Dr. John Whelan. John, tell us about Trauma Relapse Prevention Therapy Group.
Well, so we started this in 2007 for folks who had been through individual therapy for PTSD in the military. So it's all either military veterans or RCMP veterans who have operational stress injuries, the most common PTSD. So they've done their individual therapies, and they may have been, you know, stable or okay for a while, and they've had relapse. Okay. So they may have seen a number of therapists, you know, on and off. So the issue is that they can't find, you know, a period where they're stable, they're reconnected with other people, and so really the group is really meant to help move that part forward for them.
Okay. So what kind of people do come to your group?
Okay. So it goes back over 20 years. It could be soldiers, military folks who were in as far back as Somalia, Bosnia, of course Afghanistan. Navy-wise, it could be, you know, operations at sea, Swiss Air, a big thing here in the Atlantic region. So it's quite varied. So it becomes a mixture of different experiences. Even RCMP folks who deployed with with NATO have been up north and seen, you know, pretty horrific things. So it's really the diagnosis and their inability to move forward or connect with other people. That's really the thing that, for me, brings them into a group like this.
Okay. So so when they talk to you and they talk about what they've really appreciated from the group setting, what kind of things do they tell you?
They're able to say things that they've never been able to say, even to the previous therapists in the past, because they have the support of other guys that back them up, that really also hold them to being honest about really the things that they've experienced. So that connection with other people, being able to say things that they have not been able to say before out of shame or concern or embarrassment. The fact that other guys, and it's mostly guys in the groups, will back them up. They have their back, they have their support, they're not alone. And that's a huge thing. And it's so different, that's what's so different as opposed to individual therapy, where you see one therapist for 2 months, 3 months, 6 months, 2 years, but it's never talked about outside of that.
Right.
There's no way to connect with other people that may have gone through the same things. Okay. So it's a powerful way of helping.
Operational stress injuries covers a pretty wide range, and you hit on the big ones like post-traumatic stress disorder. What about those guys who deal with anxiety or depression, and perhaps they can't point back to specific events in their military history? Do those kind of guys work into this group as well?
Absolutely. I mean, they there can be a cumulative form of trauma, if you will. Complex PTSD is often called. Panic disorder certainly fits in there. Depressive disorders, you know, feeling down for long periods of time that don't respond to treatment. It could be things that have gone on in the military, you know, not the big high priority things, but just things that have happened with a bad boss in the military environment that kind of erodes self-worth, confidence, that they really you know, don't function well.
So really anybody who considers themselves to be having an issue with an operational stress injury fits into this kind of environment?
Yes, they do. And at this point, you know, it's mostly people who've been diagnosed formally with PTSD that do seek this out, or are referred by their Veterans Affairs, and you know, in some cases by the military. Very recently.
What would be the single biggest benefit that, you know, in your time dealing with mental health issues that guys get from this type of an environment?
They're able to, I would say, the ability to be able to lower their guard and to be honest about really what's gone on in their lives, to allow themselves to be emotional about things without feeling guilty or less than, and the ability to connect with other people. For me, the connecting with other people and breaking out of isolation is probably the thing that's most rewarding for me to see.
You used to do a lot more in one-on-one work, and you've moved a lot more towards group model. And you've done that for a lot of good reasons that I've heard you talk about in the past. What are some of the biggest reasons why professionally you're putting much more effort into group work than individual therapy?
Individual therapy has a lot of strengths. It allows you to have a closed, safe, confidential environment, but there are limits to how far people can move forward. One of the biggest issues I've seen, both working inside the military environment and outside, is that you can do therapy, but it's a very private thing, and you can't, there's no ability to move forward. You can't connect with other people. You can't move out of that mode of being a patient, right? So the limitation is that people aren't able to move forward in their relationships with other people because they're outside the therapy room. In this kind of format, the relationships are the therapy room. And it extends outside of here. In terms of what folks do, you know, the guys do socially, activities together, calling each other up, giving each other, you know, flack for kind of hiding away into houses again. So to me, it's another way of helping and moving a step forward.